According to a national survey from 2022, a whopping 11.4% or 7 million children have been diagnosed with ADHD. But there is a huge problem with ADHD medications like Adderall. Although they may be helping people improve their focus, they're also destroying people's teeth. So Adderall and Ritalin are the two most common drugs prescribed for ADHD. Both of these drugs are stimulants. Adderall is an amphetamine with some mixed in salts, and Ritalin is another stimulant called methylphenidate. Now, I made a separate video on some of the problems with these medications and how they're too often overprescribed. The fact is, many people think getting diagnosed with ADHD and getting some Adderall is a fix-all solution. And a lot of people will go out of their way to get it prescribed. And unfortunately, a lot of doctors will cave in. ADHD is one of the most misdiagnosed diseases. Now, I'm putting a link in the description below where I talk more about that. So if you want to check out what could be mimicking ADHD instead, make sure you check that out. But in this video, I want to focus on what these ADHD medications are doing to your teeth. One of the biggest reasons that they're bad for your teeth is they cause teeth grinding or bruxism as a side effect. The way it does this is they will stimulate the central nervous system and create a response called RMMAs, or rhythmic masticatory muscle activity. These RMMAs are basically this involuntary jaw movement where you literally grind your teeth back and forth. And this usually will happen when people are sleeping, so they don't even realize that they're damaging their teeth. Now, we also know that Adderall and Ritalin will disrupt sleep patterns. These are two of the most powerful drugs that we know of that will disrupt sleep and keep the brain awake. And we're learning a lot more about teeth grinding now and how it actually has a big association with sleep disorders. I talked before about how ADHD is often misdiagnosed. Well, estimates are that more than 50% of people that get diagnosed with ADHD actually have a sleep disorder instead. But unfortunately, most people don't know about this because ADHD testing does not involve a sleep study. And the thing is, a sleep disorder and people being chronically tired can really mimic ADHD because the symptoms are practically the same. You're more likely to be irritable, moody, chronically fatigued. So if you instead have a sleep disorder, but then you get diagnosed with ADHD, which all too often happens, and we have studies showing that, then you could be taking this medication that you don't even need that would be making your sleep disorder even worse. We know that regardless, whether or not you have ADHD and whether or not you're taking Adderall or something like that, if you're not sleeping well, you're more prone to grinding your teeth. There's a condition called pediatric sleep disordered breathing, which is literally when children have trouble breathing properly when they're sleeping. Two of the most common characteristics of this are when they grind their teeth when they're sleeping and if they are snoring. If you see a kid snoring and grinding their teeth when they're sleeping, it is almost guaranteed that they have an airway issue or they're not breathing properly when they're sleeping. And the mechanism that's thought to be behind this is when your oxygen goes down because you're not breathing well, your brain activity wakes up, then your heart rate goes up, and that causes these RMMAs or these jaw movements where you're grinding your teeth. And the thought is that this is a mechanism to protect the airway or kind of open up the airway and breathe better after. Most people see this as a normal habit to be snoring and grinding your teeth. It's seen as a behavioral thing. But all too often when I see a patient that has these symptoms and I send them to an ENT or an ear, nose, and throat doctor, it turns out that they have some sleep disorder or some airway issue. The other thing we know about grinding is there's definitely a stress component to it. People who are more stressed out tend to grind their teeth more. And the thing with Adderall is, since it's a stimulant, it can make people more stressed and anxious. So these are some of the reasons that people who take ADHD drugs like Adderall and Ritalin are so prone to grinding their teeth. I've literally seen younger people in their teens and in their 20s where half their teeth are just missing because they're grinding them away. Now, I'm not saying this happens to everybody who takes Adderall. Some people actually have ADHD and they get properly diagnosed and they actually need these medications. And not everybody who takes these medications has the same symptoms. But it is definitely real for some people. Now, for people that don't have ADHD, but have these same symptoms, but instead have a sleep disorder or an airway issue, then the biggest and simplest thing that's gonna help is gonna be encouraging breathing through your nose all night long. This might seem simple, but 50% of the people who can simply breathe through their nose all night long will get rid of any dental symptoms that come from a sleep disorder. So for example, if you have a sleep disorder and you can't really breathe properly and you instead start grinding your teeth, and if that person were to simply start breathing through their nose all night long, then he has a 50% chance of stopping his teeth grinding right there. This is based on something called the Seattle Protocol, which is basically a dental-specific way to improve someone's breathing when they're sleeping. And it goes over a series of 6 steps that eventually will involve some device that will be made to your jaw or your mouth to help open up your jaw a little bit to make that airway a little bit more open. But the first step in that protocol is to simply get someone to breathe through their nose all night long. Now you might think, how can I possibly breathe through my nose if I'm sleeping? How can I force myself to do that? Well, the simplest thing is going to be, one, using a mouth tape. The tape that I like to use is 3M micropore paper tape, which is literally this medical grade tape that you rip off a piece and tape over your lips to help encourage nasal breathing. The second thing is using a nasal dilator strip. So there's 2 different ones you can get. You can get an internal dilator or an external dilator. The internal one that I like is a brand called Mute. You can get it on Amazon or something like that. But it's this little clip that you put on the inside of your nose and you can crank it open to help dilate your nose a little bit. The external one that I like is something called Breathe Right strips, which you can literally get anywhere. Again, I get mine on Amazon, but it's literally this piece of tape that goes over the outside of your nose and it dilates the nose. The problem with those Breathe Right strips is if you put lotion on your face or something like that, then it's not gonna stick so well. Now I did make other videos kind of going into more detail about how to improve your breathing when you're sleeping, so I'm putting a link in the description below. But if both of these didn't work and you want someone to check it out, the best person would be an ENT or an ear, nose, and throat doctor. These are gonna be the people that can check your airway, check your tonsils, check everything, and make sure that you don't have an airway issue. And if you do and you need some sort of surgery, they're gonna be the people to help you. Now going back to your teeth and talking about Adderall, the other problem with these medications is they can cause xerostomia or a dry mouth. The importance of saliva is way too often overlooked. If someone does not have enough saliva, they are at a huge risk of getting cavities and gum disease. And the reason is because saliva is like a natural bodyguard for our teeth and our gums. It carries its antibacterial properties, it can wash away the plaque and food particles, and it can also dilute any acids in our mouth. All of these things, the bacteria in our mouth and these acids, are going to be damaging our teeth. So if we don't have the saliva to clean that away, then our teeth are going to be at a much higher risk all the time. So if you combine someone with this low saliva and them getting more prone to getting cavities and gum disease, and then on top of that, they're grinding their teeth, you can see how at an early age, people can start to lose a lot of their tooth structure. So what can you do if you take these medications and you're seeing some of these symptoms? The best thing is going to be to go to your dentist and see if there's any signs of tooth wear. One of the simplest things you can do to prevent your teeth from getting any worse is get a bite splint. A bite splint is also called a night guard, but it's basically this piece of plastic that goes either on your top or your bottom teeth, and it's custom made for your mouth. So you will hit evenly on it, and next time you grind your teeth, if you're wearing this bite splint, instead you're going to deflect all these forces, and your mouth is basically going to glide over this plastic. And this will protect your teeth and prevent them from wearing away. And on top of that, this will prevent things like jaw pain and headaches, which happen to so many people who grind their teeth. You also want to make sure you stay hydrated if you're taking these medications, because again, it can cause low saliva. So if you're already dehydrated, you're going to have less saliva. Now, if you combine that with the drug that produces less saliva anyway, then your mouth is going to be extra dry. So make sure you keep drinking that water. And you might also want to talk to your doctor about your dosage of your medication, see if they can adjust it a little bit so that you don't have as much of these symptoms, and also talk about substituting with a different medication that can prevent these symptoms again. You can also talk to your doctor about a saliva substitute. If you really have a dry mouth, maybe there's a different medication that they can give you to substitute some of that saliva. And the last thing, again, we already talked about is your sleep. If you're not sleeping well, it's gonna make all these conditions worse. So thank you guys for watching. I hope you liked that video. If you haven't already, make sure you hit that thumbs up button and subscribe to my channel below. And I will see you guys in the next one. Do you ever wince whenever you bite into a cold ice cream or drink a hot cup of coffee? Well, you're not alone. Over 40 million adults in the United States suffer from sensitive teeth. Now, the good news is there might be a simple way to get rid of your sensitivity. So in this video, I'm gonna go over the best ways to improve sensitive teeth so that you can